and spread to the people through the bite of infected Aedes species mosquito, mainly of the species Aedes aegypti and Aedes albopictus. The virus causing for dengue is called dengue virus and have 4 dengue virus serotypes. The 4 dengue viruses are transmitted in tropical countries that can cause syndromes that are self-limited and severe. And upsurge in research is still improving the dengue control and prevention. Today, dengue is regarded as the most prevalent and rapidly spreading mosquito-borne viral disease of human beings.
Then I will proceed our presentation with the problem statement part. The recent outbreak infectious disease in Thailand shown increasing number of deaths due to the issue. The symptoms that arise during the first infection are mild fever and muscle aches. Nevertheless, it varies with the second infection in which the patient shows severe symptoms which exhibit signs of bleeding. As a result, the most effective step in reducing the risk of disease infection is by practicing suitable prevention. However, in order to utilize the prevention, it is vital to determine the disease bear by the patients based on the symptoms, which then accurate treatment can be provided. Next, the objective of our study are to explain about the transmission of dengue disease and to investigate the prevention of dengue disease from spreading.
Dengue fever is transmitted by the bite of an Aedes mosquito infected with a dengue virus. The mosquito becomes infected when it bites a person with a dengue virus in their blood. It cannot be spreaded directly from one person to another person. Next, I'll be talking about what can be done by locals to prevent the spread of dengue. Firstly, insect repellent usage can be very useful to avoid mosquito from coming near and avoid biting. However, it is important to make sure the insect repellent is totally safe for everyone, including children and pregnant women. For children, it is important to dress them in clothing that covers their arms and legs to prevent the mosquito bites. Mosquito netting can also be used to cover strollers and baby carriers. Same goes to the adults. Wearing long trousers, long sleeve tops and socks, tucking pant legs into shoes or socks, and wearing a hat will reduce the amount of skin exposed and avoid mosquito bites. Wearing light-colored clothing, particularly outside, can also help to keep mosquitoes away. Thicker fabrics and looser cuts provide more security than lightweight, tight-fitting garments. We can also avoid mosquito bites by using permethrin-treated items. It is also important to take efforts to control mosquitoes at bay both outside and inside our house. Screens can be used on windows and doors. To keep mosquitoes out, repair holes in windows. When air conditioning is available, use it. If air conditioning or screen rooms are not available, or if sleeping outside, sleep under a mosquito bed net. Insecticide-treated mosquito nets will be more effective to keep mosquito away. Things that carry water such as tires, bin, ponds, flower pots, or trash cans should be emptied and scrubbed once a week as mosquitoes lay their eggs near water sources. If you already have a pond, consider adding mosquito-eating fish such as guppies, minnows, or mosquito fish.
Okay, cause of the outbreak in Thailand. Firstly, most of the residents in Thailand practices such as storing water in plastic container also increase the breeding potential for the Aedes aegypti. Next, the higher density of urban center compared to peri-urban and rural setting in other provinces. Aedes tend to dwell in human home. Largest number of incoming flight passengers, and the last one is longitude and latitude have also been shown to have an impact on dengue transmission potential through climate.
Dengue virus is the most common mosquito-borne infectious disease that can be seen in many countries around the world. At the time being, the primary method for controlling or preventing dengue virus spread is to combat mosquito vectors. Thus, precautions such as using insect repellent that is proven safe and using permethrin-treated items such as boots and socks must be taken into account to decrease the chance of being infected with dengue virus. It is also important to always be aware that the things that carry water such as tires and flower pots are emptied as mosquitoes breed in a small amount of water in just 14 days. All in all, prevention is better than cure, particularly when there is still no effective vaccine available for dengue virus. That's all from us. Thank you.